Okay, we're going to go ahead and get started now. Welcome, everyone. My name is Shannon Monnet. I'm the director of the Center for Policy Research in the Maxwell School of Citizenship and Public Affairs here at Syracuse University. Before we begin, I'd like to acknowledge with respect the Onondaga Nation, fire keepers of the Haudenosaunee, the indigenous people on whose ancestral lands Syracuse University now stands. Today's panel is part of our What's at Stake series, organized by the Center for Policy Research. What's at Stake is a series of discussion panels featuring multidisciplinary groups of Maxwell faculty who are here to provide insights and answer questions about the implications of laws, policies, or new developments. I'd like to thank the staff in the Center for Policy Research who coordinate the logistics for this What's at Stake series, especially Alyssa Kirk. And thank you as well to the Maxwell Dean's Office for their support of this series. I'm now going to turn it over to the moderator of today's panel, Janet Wilmoth. Janet is the director of the Aging Studies Institute at Syracuse University, and she will introduce the panelists and lead today's discussion. Thank you all for being here.
Thank you, Shannon. Welcome to everyone who is joining us for this What's at Stake session. Today, we will be discussing the book, Food for Thought, Understanding Older Adult Food Insecurity by Colleen Heflin and Madonna Harrington-Meyer. Dr. Heflin is a professor of public administration and international affairs in the Maxwell School of Public Affairs at Syracuse University. As a prolific researcher and policy scholar, she is regarded as a national expert on food insecurity, nutrition and welfare policy, and the well-being of vulnerable populations. Her research has helped document the causes and consequences of food insecurity, identify the barriers and consequences of participation in nutrition programs, and understand the changing role of the public safety net in the lives of low-income older Americans. Dr. Harrington-Meyer is a university professor at Syracuse University, where she is also a professor of sociology in the Maxwell School of Public Affairs and Laura J. and L. Douglas Meredith Professor of Teaching Excellence. She is an award-winning researcher who specializes in aging, care work, and grandparenting in the United States. In addition to the book we will be discussing today and numerous articles, she has authored several books, including Grandma's Joy, Grandparenting Children with Disabilities, Grandmothers at Work, and Market-Friendly or Family-Friendly, The State and Gender Inequality in Old Age. Her work provides deep insights into how social policies impact the lives of individuals, particularly how women balance paid work and caring for family members. I will get the conversation started with a few questions and invite the audience to put their questions into the chat. Please send those directly to me, and I'll be monitoring the chat throughout today's session and bringing your questions up in the course of our conversation. Also, please keep an eye on the chat because we will be posting links to several Learner Center population health research briefs that are related to the topics we'll be discussing. Let's get started. Colleen, let's talk a little bit about food insecurity first. What is it and how common is it among older adults?
Thank you, Janet, for agreeing to moderate. And thank you all for being here to learn more about older adult food insecurity. So food insecurity is a validated measure of well-being that identifies if a household has limited or uncertain access to adequate food for a healthy lifestyle. In the United States, the measure focuses solely on the extent to which affordability is a constraint and doesn't include other barriers to food access, such as distance, transportation, or mobility limitations. The U.S. Department of Agriculture designed a survey module that includes 18 items, 10 if no children are present in the household, that are used to categorize households into 4 levels of food insecurity. Those who respond no to all the questions are considered food secure. Those who reply yes to 1 or 2 questions have marginal food insecurity. Typically, these households report anxiety over food sufficiency or shortages of food in the house, but there's little or no indication of changes in diet or food intake. Those who answer yes to 3 to 5 questions or 3 to 7 if children are present in the household have low food security. These households report reducing the quality, variety, or desirability of what they eat, but typically they have little or no indication of reduced food intake. Those who answer yes to more than 5 of the questions, or 7 if children are present, have very low food security. This is the most severe level of food insecurity and includes multiple indicators of disrupted eating patterns, including reduced food intake. And very low food security is the level closest to the colloquial term hunger.
So can you tell us a little bit more about how common food insecurity is among older adults and which groups of older adults are most likely to experience food insecurity?
Sure. As of 2023, 16.2% of adults aged 60 and over were marginally food insecure. 9.2% had low food insecurity, and 3.2% had very low food security. Now, the share of older adults who have been categorized as marginally food insecure, low food secure, or very low food security has fluctuated over the last 20 years, with the marginal food insecurity rate showing the most change and the very low food insecurity rate remaining the most consistent. Now, levels have increased substantially between 2020 and 2023. And these changes in the levels and depths of food insecurity suggest that the experiences, mechanisms, and consequences of food insecurity in old age are not constant, but are also changing over time, particularly during and after the COVID-19 pandemic. In terms of which groups are more likely to be food insecure, the risk is not equally shared across older adults in the United States, but it falls across other axes of inequality. Household income is strongly related to food insecurity. 1 in 5 older adults living in households with incomes below 85% of the poverty line were food insecure in 2023. Women are at higher risk of food insecurity than men. Non-Hispanic, Black, and Black households face much higher rates of food insecurity than white, and other non-Hispanic individuals, including Asian, Native American, and mixed race individuals, fall in between. And another key risk factor for food insecurity is living with a disability. Certain family types are also at increased risk. Older adults are more likely than working age adults to be widowed, divorced, or separated, and each one of these has an increased risk of food insecurity. And older adults who live alone are also at an increased risk of food insecurity. Finally, living in multi-generational households, particularly skipped generation households in which older adults live with and are responsible for grandchildren, increases the risk of food insecurity.
So as a follow-up to that, I want to ask Madonna, in previous work you've written about the experience of grandparents, and this book points out that being a grandparent affects the risk of food insecurity and makes calls for changes in the way we measure food insecurity. Can you explain a little bit more about why older adults who are grandparents might be undercounted when measuring food insecurity?
Yes, in my earlier books, I interviewed grandmothers, and I never raised the question of food insecurity, but they did. So I knew before Colleen and I started this book that we were going to bump into grandparents who were becoming food insecure because they were feeding their grandchildren so much. What I didn't know was that the food security scale is only asking the 8 questions about feeding grandchildren if the grandparents and the grandchildren live together. So that was a surprise to me, and that is the very feature I'd like to see us work on improving. What we found is that about 10% of grandparents in the US live with their grandchildren. The other 90% do not live with their grandchildren. And yet 47% of grandparents are feeding and buying groceries for their grandchildren. So there's a disparity there that I'd like to see us capture better when we measure food insecurity. So for this book, I worked with actually Maxwell graduate students, and I want to give a big thank you to all of them who helped us gather this data during COVID, no less. We interviewed 63 adults ages 60 and older who are below 130% of the federal poverty line, and we did this during 2021. And when we did this, we found 3 patterns with grandparents who were feeding their grandchildren, whether they lived together or not. First of all, we saw grandparents who were eating last. They would say to the grandchildren, "You eat first, fill up on the fruits and vegetables and lean meats. I'll eat whatever's left over." The second pattern was skipping meals entirely. We had a lot of grandparents tell us, "I just don't eat so that they have enough food to eat." And the third pattern, and this I had not seen before in my earlier work, was grandparents who were saying they spent less time with the grandchildren because they couldn't afford to feed them. So they would tell their adult son or daughter, don't bring them over. Or when the grandkids came over, they would worry about trying to feed them. Alex is one of the people we interviewed, and he and his wife had to turn down a lot of invitations to spend time with the grandchildren because they couldn't afford to feed them. And he said to me, yes, we'd love to take them out for ice cream. We can't afford to.
Thank you for sharing those experiences, Madonna, that the participants were telling you about. Colleen, I'd like to come back to you for a second and talk a little bit more about food insecurity measurement. It's been in the news a lot lately, and could you briefly describe why that is?
Yeah. So just a few weeks ago, on September 20th, the U.S. Department of Agriculture announced that it will no longer collect data on food insecurity beginning in December 2025. This was a shock to the field. And it means we're no longer going to be able to track food insecurity using the same data set and measures that we've had for nearly 3 decades. As a consequence of this decision, federal, state, and community efforts designed to address food insecurity will no longer have this data to guide their efforts so that they can focus on the demographic and geographic communities with the highest levels of need.
So we'll follow up, I think, on this a little bit later in the hour, talking about it a bit more. But before we do that, I wanted to ask Madonna to talk a little bit more about the experience of older adults when budgets are tight. Food competes with other essential items like housing and medical care, and adults often have to choose between food and rent and food and medical needs. So what expenses do older adults tend to prioritize, and where does food fall relative to other types of purchases?
Right. So food insecurity often takes place inside of a web of all kinds of economic insecurities. And when budgets are tight, we found older people are having to balance buying food and buying other essential household goods. So the two that they most consistently prioritized before food, and this was a bit of a surprise to us, were housing and utilities. Although it doesn't take much to think about why they would prioritize them first. So when it came to housing and utilities, they tended to pay for rent and pay for utilities first and buy food second. But the other essential expenses like medical care, transportation, personal care items, cleaning items, there was more of a tug of war. They tended to alternate from month to month, and they tended to alternate over time between different recipients.
So can you talk a little bit more about how recent policy proposals might reshape budget trade-offs between food and housing?
Right. There's an endless supply of recent changes to policies and programs that Colleen and I are trying to stay on top of since this book came out. And one of them is related to housing. So affordable housing is in short supply in the US. We all know this. And so if budgets are tight, being able to afford your housing is very difficult. This is particularly true if you need accessible housing. The estimate I saw was that 4% of our housing is accessible. So when it came to housing, our respondents told us that they prioritize housing over food. They said they would rather be hungry than homeless. They could imagine doing without their next meal, but they could not imagine doing without the roof over their heads. So one of the ways that people who have very small budgets negotiate housing is to go through subsidized housing. Now, this program is already not sufficiently funded. About half of all people who get in have waited 2 years or more to get in. And there have been some recent changes to subsidized housing in the United States. So for example, there have already been some cuts to the staff and some cuts to the funding, but there's a proposal now, we will see if it comes to fruition, to consolidate all the subsidized housing programs into state-controlled block grants and to cut those budgets by 50%. If that comes to fruition, it's very likely that the wait for subsidized housing and the availability of subsidized housing will become even tighter than it already is.
So can we talk a little bit more about the trade-offs between food and medical expenditures? Since you wrote the book, Medicaid has undergone substantial budget cuts. How will such changes reshape those the trade-offs between food and medical care?
Right. Our respondents alternated between paying for medical care and paying for food. Some of them said the medical expenses are just so big you would literally never eat again. Other ones said, I have to get this tooth fixed or I'm not going to be able to eat anyway. So sometimes they put food first and sometimes they put medical expenses first. When we're thinking about medical expenses, we think older people tend to be on Medicare, but people who aren't yet 65 can't be on Medicare. And also Medicare doesn't cover everything. People accumulate debt before they're old enough for Medicare, but they also accumulate debt while they're on Medicare, medical debt. And Medicare excludes a lot of expenses, and it doesn't cover vision, hearing, and dental care for most people. And so these are expenses that older people have to balance between paying for food and paying for medical care. Medicaid cuts are only going to make this more difficult, I think. And so especially if more people are uninsured, one of the things that I think Colleen and I really found important as we worked on this project is how much food insecurity in old age is really a story about life course. Very often people seem to be on a pretty good solid trajectory, and then one thing happens when they're middle-aged. They become disabled, they lose their spouse, they lose their job, and they kind of go off the rails a little bit. And then all of a sudden they're accumulating medical debt and they're struggling to get on programs that they're not able to get on yet. And so cuts to Medicaid are going to hit that 55 to 65-year-old group before they're eligible for Medicare, especially difficult, we think. We think that'll take a big toll.
So shifting to a slightly different topic, the book mentions that the official USDA measurement of food insecurity in the United States asks questions about whether respondents are able to afford food. But in the book, you write about financial factors that contribute to food insecurity, namely poor physical and mental health, lack of access to healthy food, and transportation challenges. Let's talk about each one of those. But Donna, can you tell us a little bit more about how poor physical and mental health contributes to food insecurity?
Absolutely. One of the things we think is very important to think about with this project is that a lot of the solutions, a lot of the causes, and a lot of the solutions to food insecurity lay outside the food system. And so poor health is a big contributor to food insecurity. Health declines with age. As people are old, they're more likely to have poor health, they're more likely to have chronic conditions, more likely to have disabilities, more likely to have functional limitations. All of these things contribute to food insecurity, but also food insecurity contributes to all of those things. It's a two-way street. They're both cause and consequences. So one of the things to think about is that buying groceries and preparing food and cleaning up afterward requires strength and stamina that not all older people have. It could be a lot of work to get to the bus stop and even more work to get home from the bus with your bags of groceries. And it can be a lot of work to go up and down the aisles, to fill your cart, to reach things, to store them in the car, and particularly a lot of work to get the groceries up the steps if you have steps when you get home. And just preparing a meal requires you to stand there and chop and stir and clean up afterward. All of these are physical things that can really get in the way and make it that you're more likely to be food insecure. But it's not just physical changes, it's also mental health problems. Mental health problems can also contribute to food insecurity and vice versa. So as people age, they might be more likely to become food insecure because they have anxiety, they have depression, they have loneliness, they have poor sleep. And we can really see ways where those things interfere with your ability to get the groceries and your ability to prepare the food and consume the food. When women become widows, one of the things they say is, it's just too hard to cook for one. It's too much trouble to cook for one, so they don't do it. We had respondents in our sample who were too anxious to eat. And one was too anxious about her Parkinson's disease. It was getting worse over time, and she worried that her shaky hand would make it so that she wouldn't be able to prepare food and therefore not be able to live independently anymore. People had anxiety about inflation. Food prices were going up, which they still kind of are. And people were worried about living long enough to launch their grandchildren. And they were worried about an unexpected expense. What if my car breaks? I'm on a very tight fixed budget. One more thing will be just enough to upset the entire balance. So all of these things make it difficult to think about preparing a meal and consuming a meal properly. The last thing I just want to point out is how important loneliness is. So loneliness, a lot of people who are older who are food insecure live alone, and loneliness can really contribute to food insecurity, but food insecurity can also contribute to loneliness. So if you're alone, you're less likely to prepare proper meals, you're less likely to consume appropriately balanced meals. People who live with other people are more likely to eat proper meals at proper times. But the other side of this is that people who are food insecure often have to decline social invitations because they can't afford the food that comes with them. So Janet, if you invite me for coffee and I can't afford the coffee, I just simply say, oh, I'm busy on Sunday, but really I can't afford the coffee on Sunday. And we had a lot of respondents talk to us about how they declined social invitations. For me, one of the saddest things were people who had stopped going to church because they couldn't afford to put money in the basket. And then they missed the meals at, churches often have like soup and bread after church, and they would miss those meals and the social part of that.
So for these older adults, another dimension is having access to healthy food. So can you explain why it's difficult for some older adults to have access to fresh, healthy foods?
Yes, the grocery store might be too far away. You might not have transportation to the grocery store. And one of my pet peeves is grocery stores often have bulk sales. People talk to us about that. They would try to go to the grocery store on the day that they broke down the bulk sales. My grocery store here in town, who I have fought with but lost, they sell fruit by the box in the summer. And if you buy 2 boxes, you get 5. If you buy 1 box, you get 1. If you buy 2 boxes, you get 5. What is a person with a limited income who lives alone supposed to do with 5 boxes of fruit? And so one of the things I like about Wegmans, in fact, is you can buy half a loaf of bread, or you can buy just a few flowerets from the cauliflower head. You don't have to buy the entire head. So grocery stores, often when you do get fruits and vegetables at grocery stores, they're too expensive. And the ones that are marked down are usually starting to go bad. A lot of our respondents were making soup because they had produce that was about to go bad and they were trying to find a way to use it before it went bad. Now, when you go to the pantry, you might have all the same problems. It might be too far away. You might not have transportation. It might be closed on the day you need to go. But they often pantries tend to have whatever gets donated to them. So sometimes they do buy food, but a lot of the food at pantries has been donated. And so often manufacturers will donate food that they can't sell in order to get a tax break. So if a company produces a granola bar that no one wants to buy and they can't sell it, they will often just donate it to the food pantries for a tax write-off. This means that when you go to the food pantry that week, you might get a lot of these granola bars, and they might not be very good for you either. People didn't want to buy them, and you might not want to be eating them either. So pantries sometimes have a lot of good produce, but sometimes they don't. And this can be true for Meals on Wheels as well. They can deliver food to your house, and it can be a real godsend when you need it. But sometimes that food is frozen or highly processed, or it may have high fat or salt or sugar content. It might not fit your dietary needs. So what people do when they can't get to the grocery store and get good food is they go to the dollar store. A lot of our respondents talk to us about buying food at the dollar store. There's not a single fresh fruit or vegetable at the dollar store, I don't think. And most of the food they bought there was frozen, boxed, or canned, and they knew not nutritious. It was affordable, but it wasn't nutritious.
So you've mentioned transportation several times in the book. It comes up as a repeating theme. Can you talk a little bit more about how transportation challenges impact food insecurity?
Transportation is a big part of the food insecurity story. If you are relying on public transportation, but there is no bus either near your house or to the destination you need to go to, it's not very helpful to you. Buses often have steps that you have to get up and down, which you might not be able to. We had people who used travel carts, almost kind of like wheelchairs, or else canes and walkers, who were trying to use the bus, and talked about how difficult it was to do that. It's even more difficult to get home from the grocery store or the pantry with your groceries if you're taking the bus. And also the bus might be too expensive. To people with a good income, $1.50 a ride doesn't seem like much, but to people with a very limited monthly budget, $1.50 might be more than they can afford. Public transportation is one set of issues. Private transportation is a whole different set of issues. We talked to a lot of people who had cars, but they couldn't afford to drive them. They didn't have money for the gas. They didn't have money for the repairs. They didn't have money for the new tags or for the inspections. We had people who couldn't drive their cars in the winter because the heater didn't work. People who couldn't drive their cars in the summer because the air conditioner didn't work. People couldn't drive their cars at night because the lights didn't work. So transportation can be a steady issue. A lot of people got rides from people, but they very often mentioned that they had to give their friend who gave them a ride $1 or $2 for the ride. And that adds up if your budget is very limited as well.
Thank you, Madonna. Colleen, I'd like to ask you to share with us a little bit more about federal programs that are in place in the United States that support people who experience food insecurity.
Sure. So the largest and the most important is the Supplemental Nutritional Assistance Program, SNAP, still called food stamps in many states. This is the program that provides low-income households from birth to death. And it has special provisions that make it easier for adults age 60 and older to apply for and qualify for SNAP. The Older American Act is also a federal source that covered $1 billion worth of funding in 2024 for nutrition services, including home delivered meals, often referred to as Meals on Wheels, congregate meals, which can be served in senior centers and public housing complexes, and incentive grants. The federal government also supports food that is eaten in food pantries and food banks across the country. And of course, that source of emergency food assistance serves all ages and receives funding from federal, state, community, and private sources. Feeding America, the largest organization, received over $5 billion in private donations to provide over 5.4 million meals in 2024. So we have a very complex network of food assistance, some which is a very small piece of which is focused on older adults, and most of which is open to all ages.
So can we talk a little bit more about SNAP? In the book, you report that only 55% of older adults who are eligible to participate in SNAP actually participate. So why do older adults enroll in SNAP at lower rates than other age groups?
Yeah, that's a really important question. And one of the compelling reasons that I wanted to work with Madonna to do this project in the first place is to understand this. So policymakers designed SNAP as a means-tested program that's limited to low-income households with a set of administrative processes to ensure that the program awards benefits to cover the food needs only of households without other means of support, without saving assets or work opportunities. So application and recertification processes are designed to identify and prevent fraud. So the term administrative burden is often used to refer to these set of processes individuals go through to access these benefits. Researchers frequently identify 3 different types of administrative burdens that pertain to social programs. First are learning costs. These are the costs individuals encounter when trying to figure out what programs they might qualify for and how to apply. Compliance costs are the second, and these involve providing necessary documentation and meeting eligibility requirements. And then the third is psychological costs, which may result from stigma or the mental burden associated with interacting with the government and encountering that feeling of distrust and just the anxiety of the process. As a group, older adults and those with disabilities are more likely to find these administrative processes to be a barrier to participation than other groups of adults. That is, the processes can feel more confusing and more burdensome to lower levels of people with lower levels of education and computer literacy, and greater difficulties with transportation, mobility, and sometimes sight, hearing, and cognitive functioning difficulties as well. Take, for example, one of our respondents, Kira, age 68. She was food insecure in part because she received $135 a month from SNAP. But she told us how she was overwhelmed by the amount of paperwork. She said, well, I hate doing all that damn paperwork once a year. I mean, God, I haven't changed anything. Stop putting me through this. I recently recertified for food stamps, and I'm just, goodness gracious, I'm poor, leave me alone. So many people talked about the difficulty getting through the processes. Yeah.
So we have a question in the chat from Joshua Grove that I think relates to this. He said, did you find that people were unaware of the programs that are available to them, or was it an issue that they either did not qualify or were worried about stigma, or was what was being offered not enough? So I guess it's a question about the balance across those different types of reasons people don't participate. Which ones do they mention all of them, or is it an awareness issue or a stigma issue, or a little bit of a combination of these administrative burdens on top of those other topics?
Yeah, I will give Madonna a chance too, but I would say it's all of the above. I think people usually aren't aware of everything they qualify, everything in their community, just like probably most of us don't know all the services that are available in our own communities. Until you need them, you're really not aware of them. It's difficult to access them. And sometimes people are made to feel unwelcome. And so I think there's a combination of reasons. But Madonna, I'd love to hear your
I agree with Colleen. Joshua, you nailed them all on the head. These are all the reasons that older people aren't doing SNAP when they could be doing SNAP. We had a lot of respondents who some talked about not knowing about the program, only recently learning about it. Some talked about some stigma related to being on a poverty-based program, maybe for the first time in their lives. More often, they talked about two key things. It was just too darn hard to get the paperwork in order, the right place, the right time. I remember one man told us a story about, to qualify, he needed to provide examples or copies of his medical bills. And he went down to the office and he waited in line a long time, and he finally got up to the front desk and he said, okay, here's all my medical stuff. And they said, oh, you don't need to wait in line for that. There's a scanner out in the hallway. Well, he doesn't know how to use the scanner, and he had already waited in that long line, and they wouldn't even come out and help him scan. So at that point, he had to go home and find somebody who could help him run the scanner to come back and help him use the scanner to get himself qualified. But the other thing people talked about was that the benefits were just too small for all the hassle. When we conducted the interviews, the lowest benefit was $16 a month. And we had several respondents who were getting $16 a month, but it went up to $23, and it is now still $23. And so for people whose benefits are very, very small, all of that paperwork and all that hassle just seems like it just can't possibly be worth all the trouble.
Madonna, Joshua has a follow-up question for you about the grandparents raising or feeding grandchildren. Are they legal guardians and thus qualify for SNAP, or are they raising them without access to that because of custodial issues?
Right. So again, I'm going to separate out. There's 10% of grandparents who live with their grandchildren. Of those 10%, 30% have primary responsibility. They're not necessarily legal guardians at all. And that's a big distinction, because in my interviews with grandparents for earlier books, grandparents would say, I know she's a terrible mom. I know she's a drug addict. I know I need to take charge of this child, but I don't want to go through the court systems to become her legal guardian. And so some of them who are living together are not eligible for SNAP, even though they might be providing a great deal of grandchild care. But the 90% of grandparents who do not live with their grandchildren are absolutely not eligible for SNAP on the basis of feeding their grandchildren. They would only be eligible for SNAP on the basis of their own household income and their own household size.
Great. Thank you, Madonna. So, Colleen, can we talk a little bit more about how states administer the SNAP program? Given that it is administered at the state level, there's substantial variation in household income and asset levels that determine eligibility, as well as those administrative hurdles that you mentioned. Are there some states like Rhode Island, in which Rhode Island in particular, 78% of older adults who are eligible to participate in SNAP actually do participate? So there are some states where participation rates are high. Which states are those, and what are those states doing that encourage SNAP enrollment among older adults?
Yeah, so let me go back a little bit and say, although SNAP is a federal program, the states administer it. So that means the program varies across states as a consequence. And further, in 10 states, county officials administer SNAP to their local population. And so local administrative practices can differ across the state. Currently, the federal government fully funds SNAP benefits and covers 50% of the cost of administering SNAP. But starting next October 26th, this is going to shift. so that states and counties will have to cover 75% of the cost of administering SNAP benefits. So we're likely to see variation increase more as a consequence. Since the early 2000s, states had been able to make decisions regarding household income and asset levels that determine eligibility, the shelter and utility expenses and out-of-pocket medical expenses that determine benefit size, and the complexity of the application process and the timing of the recertification process, as well as restrictions on redemption of benefits that you're seeing a lot more in the news. So the U.S. Department of Agriculture has a state waiver process through which states can choose to make benefits more or less generous for participants, to increase or decrease eligibility criteria governing who qualifies for benefits, and to make the process of application and recertification more or less onerous. So this is why we see such large amounts of state variation. From 22% of eligible participants among older adults in Wyoming in 2018 to 78% in Rhode Island. Now, there's not a more recent figure since 2018. USDA hasn't released it at the county level. But I have to think moving forward, we're going to see even more variation as a consequence of the shifting of the administrative costs. So right now, some states put out a welcome mat for older adults that combine SNAP benefits with other programs such as SSI. They have a 36-month certification period, and they waive eligibility interviews to encourage SNAP participation among adults 60 and over. While others have a 12-month recertification process, require more documentation and more frequent interviews. So currently 25 states, including New York, our home state here, have adopted the Elderly Simplified Application Project, which bundles, which allows states to choose different aspects of these or all of them.
Thank you. Madonna, did you want to? Oh, okay. All right. So we have a question in the chat before we leave the topic of SNAP participation. Someone has asked the question for the researchers in the audience, whether SNAP participation can be used as a proxy for food insecurity in data sets that don't have measures of food insecurity.
No, I think that's really dangerous. And SNAP is one way that households become food secure. Right. In fact, the level of food insecurity is, there's a large chunk of people who are not poor who are food insecure because they don't qualify for SNAP. And so we should not equate SNAP participation and food insecurity. That is a empirical fallacy, and do not fall into that because it's simple.
Great, thank you for that guidance. So going back to this idea that programs to address food insecurity are funded at the federal and state level, also community-based food programs are funded through a patchwork of public and private funding, and there's substantial variation across accessibility across different geographic locations. So Colleen, how does that impact older adults' use of those community-based services?
Yeah, so overall, levels are really low. In 2023, 2.6% of older adults received a free meal in the previous 12 months. And this goes up to 7.7% if we limit our analysis to those below 185% of the poverty line. If we wanted to talk about access to free groceries, 6.6% of older adults in 2023 reported receiving free groceries. And this goes up to 18% when we limit our analysis to those 185% or lower. But access to community-based programs varies considerably depending on what community you're in. And let me tell you a little bit about one of our respondents, Ophelia, a 69-year-old woman with low food insecurity that we interviewed for this book. Ophelia had a college degree. She worked in a daycare center for 25 years, but as a single mother, paying the bills was never easy. When we talked to her, she didn't have a car, and she found it difficult to get to the grocery store, the food pantry, and the senior center to obtain food. So you see the transportation barrier coming back again. Before COVID, she had volunteered at a local center where she received 2 meals a day. She went to a senior center also several days a week using free transportation. But the center that she had gotten 2 meals a day closed after COVID, and the transportation was no longer free to the senior center when we talked to her. So by the time we talked to her, she was only able to go to the senior center once a week, and she timed that on the same day that the church next door had their food pantry open. She told us she'd love to go to the senior center more frequently, but she couldn't afford the $2.56 public transportation costs each way. She said, yeah, I love to see my friends when I go to the senior center. We run our mouth, we play cards. You could tell it was a real source of joy for her. Again, that connection with loneliness, right? But it just wasn't an option. She also told us that much of the food she received at the food pantry was highly processed and rarely included fresh fruits and vegetables, echoing what Madonna had characterized earlier, and that eating that type of food made her feel terrible.
So talking a little bit more about demand at food pantries, cuts to SNAP are expected to increase the demand at food pantries, yet the Trump administration recently cut $1 billion to food banks. Some resources are now being released to food banks, but they face increasing demands with limited resources. So Madonna, I was wondering if you could comment on how well food pantries are providing services to older clients.
Demand at food pantries went up during COVID, and it has stayed pretty high. Some of the most recent reports indicate that many of the food pantries in the country are still having record high turnouts of people of all ages. So there's a big demand for pantries. We're building more pantries than ever, and the people using pantries are getting older than they've been before. So we're seeing a higher percentage of the people going to pantries being 65 or older. And in fact, in 2022, 15% of all older adults received food from pantries at some point. And so there's a lot of demand for pantries, especially among older people. In our interviews, we had a lot of extremely positive comments about food pantries. People who thought they were just getting wonderful things. They especially appreciated when there was fresh fruits and vegetables, when there were lean, healthy meats, that kind of thing. And we haven't talked about this at all, but one thing they really appreciated was when pantries provided non-food items as well. So if you go to the grocery store to buy, dish soap or laundry soap, that can cost a lot of money. But if you can get it for free at the pantry, that can really make a big difference in your household budget because it frees up money for food. And so people had a lot of really important, good things to say about food pantries. But these budget cuts are likely to make the strain on these pantries even longer. And so there is quite a bit of concern moving forward, especially with SNAP cuts, that the burden on pantries is just going to get a little bit too high. Yeah.
And can you tell us a little bit more about how food pantries work in terms of, we know they're can be, expensive and complex to run, but they're also not necessarily well designed for older adults. What are some of the key problems that you see with the design and implementation of food pantries?
The first thing to know about food pantries is no two are alike. They just vary so significantly. Your pantry might be enormous and open 5 days a week for 8 hours a day. Your pantry might be open 1 day a week for 2 hours. So you have to know exactly what hours are available to you. Your pantry might limit access to the pantry to people in this exact zip code or people in these exact blocks. Or your pantry might have an open arm, come one, come all kind of attitude. Your pantry might have a lot of fresh fruits and vegetables, especially this time of year. There's so much produce around. And they may be very open and flexible about how much of that you take with you. Or your pantry might have very strict guidelines. We talked to people who were only permitted to go to their pantry 1 time a month. We talked to people who got to their pantry and they were only permitted to take home 1 roll of toilet paper or 1 apple, that kind of thing. So the restrictions might be quite pronounced at your pantry. So there's not really a way to know what all the pantries are like. And so the respondents gave us 63 views of pantries. Some people had multiple pantries that they could go to. So they would go to one on one day, one on Wednesday, one on Friday. Others had only 1 pantry anywhere near them. And it was a very big transportation problem to get to it at all. So there's a great deal of variation with pantries. Some pantries are also offering a great deal of fresh produce and really healthy foods, but other pantries are mostly offering boxed and canned and processed foods. During COVID and since COVID, a lot of pantries have shifted to drive-through pantries. So instead of walking inside, you can drive through. In some respects, that's wonderful if you have a car and you have enough gas to be able to wait in a long line. They might put the food in your trunk for you, but that almost always eliminates choice. You're going to get a pre-packaged box of goods. So the things in your box may be good for you and they might not be good for you at all. Let's say if you have diabetes or other health conditions that are very nutrient sensitive, very diet sensitive. And so switching to the drive-through lines can be a helpful thing, especially if you have mobility problems, but it can also be a very difficult thing if you don't have transportation, or if sitting in the car for too long is too difficult, or running out of gas is a problem. One woman told us that she was in a long line waiting for the box of food to be put in her trunk, and she kept turning off her engine. And finally, one of the workers came over and said, "Why are you turning off your car and turning your car back on?" And she said, "I'm going to run out of gas and I don't have any money to go get gas." And he reached in his pocket and gave her a $10 bill from his own money just to help her survive being in line at the food pantry. So that's another thing that older people have to take into account.
So you mentioned COVID. We do have a question in the chat about how things might have been different during COVID than they were before COVID or now. So Madonna, did you find anything else that was better or worse for your respondents during COVID? Any other?
Yes, there were some important things that were actually better during COVID. Several people said to me their situation was better during COVID because they'd gotten stimulus checks, which they then used to fix their car or pay for their tags or fill their gas tank or fill their pantries. A few people said to me during the interview, we actually have more food now than we've really ever had before because we used our stimulus check to stock up. Now, be clear, they're stocking up on boxed and canned food because you can't really stock up on fresh food. So that was one big thing. Another big thing was that SNAP benefits were bigger during COVID. There was an augmentation to the benefits. And many of the people we interviewed had really liked how much that larger SNAP check got them through the month. It stretched their food budget out much further into the month. And they were really worried about what was going to happen when it was retrenched. And of course, for all of them, it was retrenched. So that was the second thing. SNAP benefits were bigger. And a third thing was they were very aware that there was a ban on evictions and a ban on turning off utilities. So if you didn't pay those bills in full, they shouldn't be able to evict you and they shouldn't be able to turn off your lights or your power. And so in general, I would say that during COVID, some people, not all, had more money and were less worried. There was a sense of a safety net that was providing a little bit more protection than usual, and they appreciated that. But there were some difficulties as well. By far the biggest one is that nearly every place you would go to get free and subsidized food, all the community programs were closed. So senior centers had no choice. They closed their doors. Food pantries, soup kitchens, a lot of them closed their doors. And if they didn't close, they switched to no contact pre-box allotments. So you could drive through or walk through, or they might deliver to your subsidized housing a box of food, and then you just got whatever you got. So your ability to make choices in that food was gone. So that was a difficulty. There was a lot of talk about the buses, and this was from all around the country. During COVID, buses had to socially distance. And so if there were too many people on the bus, they would drive right past them. So they talked about going all the way out to the bus stop and standing there waiting only to have the bus go by because the bus was already full using the social distancing rules. And a third thing is the isolation was really bad. We've already talked about how isolation really contributes to food insecurity in old age. But with so many things closed, a lot of these people who lived alone in the first place didn't have places that they could go out and be. Churches were often switched to online. A lot of people who had volunteered stopped volunteering. And one thing I found very sad was a lot of people who had gone to church their whole lives stopped going to church during COVID and then were not going, they hadn't restarted again. They hadn't turned that key again. And so this was true with volunteer work as well. Once they stopped, they didn't get back into the habit. And so I'd love to follow up with them now to see a couple of years later if they have returned to church in person, or if they're still doing church online or not doing church at all. But the social isolation and loneliness really grew during COVID. And this was a thing that a lot of our people talked about. This is a very sad story, but one woman who I interviewed told me one of the things she liked best about COVID was she has dentures and they don't fit properly, and she needs to pay to have a new set of dentures, but she can't afford to. So she's been trying to save up enough money to get a new set. During COVID, everywhere she went, she had to wear a mask. And she said, this is the one time that no one can see that my dentures don't fit well. So there were pros and cons during COVID, but that's a particularly sad pro, right?
Yeah. So of these changes that happened during COVID that were more positive in terms of strengthening the social safety net, Colleen, are there any of those changes that you think should be reinstated now? And I'll add this in terms of thinking about what type of policy changes would you recommend moving forward to reduce food insecurity among older adults?
Yeah, so we have 5 policy recommendations to improve older adult food insecurity. And let me just go through those now. So the first is, first of all, to measure food insecurity, but to measure food insecurity in multidimensional ways. So it's critical we continue to collect the USDA measure of food insecurity at the national level, but we also need to consider adding to that measures of physical food insecurity, nutrition security, and transportation barriers. Second, we need to treat food insecurity as a health issue. In our country, we provide public health insurance for nearly all older adults age 65 and older through Medicare. And given that food insecurity has negative consequences for health, we need to better incorporate screening for food insecurity and appropriate measures to address food insecurity into our health system. Third, states should adopt SNAP policies that increase benefits and participation among older adults. States have a wide range of options that they can choose to adopt to make it easier for older adults to enroll in SNAP. As I said, 25 states have already taken important steps, but the rest have not. And so states need to take steps to make SNAP more stable over time, make it so older adults can receive higher benefits. With only 55% of eligible adults participating in SNAP, states simply need to do more. Fourth, we need to connect SNAP with other social programs by using combined applications and simplifying and aligning enrollment processes. And we should do this for public housing, heating assistance, congregate dining, home delivered meals, and Medicaid, in addition to SSI, which is what there are currently some demonstration programs for. And then 5, we need to increase income support for older adults. We find that food insecurity among older adults is related to retirement insecurity. Older adults would not require this complicated web of social programs if they had enough money to live comfortably and meet their basic needs. So we need to address low benefit rates in Social Security. Given that the problem is multifaceted, we think that we need a multifaceted approach that truly begins with the measurement of food insecurity and ends with addressing the retirement security of older adults.
So we have a question in the chat from Calvin Tran. He said, what do you think the role of medically tailored meals and the food is medicine movement might be in addressing food security among older adults? Is it possible to see a future in the US where food is a basic human right?
I think that's a really great question. My own take is that I think there's some interesting promise for these types of interventions that provide medically tailored meals and medically tailored groceries, but the evidence is still not clear enough to me that that is about how to roll these out. Which conditions is it supportive? Should this be used in combination with SNAP or as a substitute for SNAP? I think there's a lot we don't know about who it works, how it works, and under what implementation conditions. So I'm really interested in this. I currently have an intervention right now with the VA that I'm doing a medically tailored grocery intervention there to try to learn more about this. And I think as a field, we really need to think, because it's not clear to me, SNAP, one reason people might not be older adults may not participate in SNAP is because they're not cooking anymore. They're not shopping and cooking. And so this might be a place for medically tailored meals. And again, trying to think, how different is that from home delivered meals? Again, there's a lot of questions there, and I think the edges aren't very clear at this point.
Great. So we've got about 4 minutes left. So I'd like for us to close on a question about the moment that we're in right now, and sort of acknowledge that the book overall, I think, has an upbeat tone. And, you went to press early in 2025, very early in the Trump administration. And given what's transpired since that time, how has your outlook changed? And how do you think these recent changes are likely to impact food security among older Americans? Either one of you who would like to answer that.
Well, I'll say our safety net is nearly 100 years old and was not designed with the older adults in mind. As older adults are going to comprise a larger portion of the adult population, we really need to rethink the structure. I tend to be a glass half full type of person, and I really wanted the book to have some energy behind it. And so I think it is hard to keep that energy in the current moments, but I think I'm trying to think maybe 2 steps ahead. I don't, clearly what's happening is not going to be beneficial for food insecurity. And if we can't measure it, it'll be harder to be effective at addressing it. But we need to be putting our heads together and thinking about what would be a better structure. Because what we have is not what we should go back to, I would say. We need to move forward in new directions. Maybe it's medically tailored meals and groceries. Maybe it's combining other of these programs and funding streams. We need to be open to change, and we need to think boldly moving forward while we're still trying to address the growing problem that we know we're going to be seeing.
Madonna?
I think it's really important to echo what Colleen said earlier about how the causes of food insecurity are very widespread and the consequences are very widespread. So our solutions need to be very widespread as well. There are many, many programs already in place that are not fully funded that we would like to see fully funded. So for example, subsidized housing, the wait list shouldn't be so long. LIHEAP, which helps you with utilities, only about 20% of people who apply ever get help. SSDI and SSI disability benefits, about 67% of people who apply for SSDI never get benefits. And about 57% of people who apply for SSI disability never get benefits. These are programs that we already have that are not fully funded that would really help reduce food insecurity by taking care of the other expenses that people are making budget trade-offs with. So we'd like to see us moving forward put the everyday realities of the people we interviewed into the fabric of what the new programs are going to look like, so that older adults are taken into account when we invent each program we invent. We ask, is this something older adults are going to be able to do? Is this something people with disability or people with chronic conditions are going to be able to do?
Well, thank you, Colleen and Madonna, for a very informative discussion of a really critical topic at an important point in our history. I appreciate your insights. Thank you to Shannon and the staff at the Center for Policy Research for organizing this What's at Stake session. It's my understanding it will be available online on the website. So please, if you have questions, feel free to reach out directly to Colleen and Madonna afterwards. And thank you very much for your participation today.
Thank you all.